Now that we have learned how MIST therapy works, we will review the setup and treatment instructions for administering the therapy using the UltraMIST system. Before beginning, you'll need an UltraMIST generator, treatment wand, power cord, applicator, bag of normal saline, gloves, disinfectant wipes, and absorbent pads. Place an absorbent pad under the portion of the patient being treated to collect the saline runoff. After the patient is positioned comfortably, remove all soiled dressings and discard all contaminated materials. Measure the wound to determine the appropriate treatment time and saline requirement. Clean the UltraMIST system prior to use with a disinfectant wipe, following your facility's infection control procedures. With the power switch in the off position, plug the generator power cord into the back of the generator and into an electrical outlet. Ensure the treatment wand cable is attached and fully seated to the front of the generator by aligning the red mark on the cable with the red mark on the connector. Turn the system on. After the self-test is completed, use the keypad on the treatment wand to select the number of wounds to be treated.
Okay.
Press the check mark to continue. Use the keypad to enter the size of each wound to be treated per the screen prompts. The total saline requirement for the combined treatment area is displayed, approximately 100 milliliters for every 25 centimeters squared. Press check to continue. The display screen will ask for the applicator to be loaded. Remove the applicator from the packaging and press the applicator onto the treatment wand. Ensure the applicator is fully seated prior to use with the metal tip visible in the center. Insert the applicator tubing into the treatment wand tubing channel and attach the tubing clip to the treatment wand cable. Place the treatment wand in the cradle once completed. Select the appropriate size saline bag. Remove the saline bag from the outer packaging. Remove the protective cover from the applicator tubing spike and saline bag port. Insert the spike fully into the saline bag. Allow the saline to run through the applicator tubing until saline is noted at the distal tip. Close the tubing clamp. Note, if the saline tubing is not primed during setup, delivery will be delayed once treatment is initiated. If using a flat work surface, extend the hook and position the generator near the edge, and attach the saline bag. Adjust the position as necessary so the saline bag hangs freely, the generator is stable, and there is no pressure on the treatment wand connector. The display screen will ask for the saline pump to be loaded. Open the saline pump door. Loop the applicator tubing from the saline bag through the saline pump from left to right using the tubing guides to center the tubing. Close the pump door. Leave enough tubing to allow the saline bag to hang freely with the majority of the tubing between the pump and the treatment wand. Open the tubing clamp. Saline will not flow until the treatment on-off button is initiated. Press check on the keypad to continue. The system is now set up and ready for treatment.